Welcome to the 15th International Family Nursing Conference, Family Nursing Throughout the Life course, and the International Family Nursing Association's award ceremony in virtual format. The first award category is the Excellence in Family Nursing Award. This award recognizes IFNA members for outstanding contribution to the development of family nursing practice, research, and/or education through either cumulative career achievement and/or a single contribution that has played a seminal role in the field. 3 distinguished scholars received this award. The first awardee is Dr. Maureen Leahy. Dr. Maureen Leahy is an international nursing leader, consultant, author, educator, and clinician in the area of family nursing and family therapy. Dr. Leahy served as an adjunct professor in both faculties of nursing and medicine, University of Calgary, for more than 25 years. Dr. Leahy has distinguished herself by developing many new ideas for nursing assessment and intervention with families experiencing illness. She helped coin the term family systems nursing to distinguish generalists from advanced practice with families. She is an expert clinician who provided models of live supervision for growing the practice skills of nurse clinicians and other healthcare professionals. Dr. Leahy was one of the first family nursing clinicians to show the value of demonstrating her own clinical work in her teaching, workshops, and conference presentations. Dr. Leahy, along with her colleague Dr. Wright, developed 2 generalist practice models known as the Calgary Family Assessment and Intervention Models, which were introduced in the book Nurses and Families, A Guide to Family Assessment and Intervention in 1984. The theoretical and clinical ideas and models in the book, which is now in a 7th edition, has been widely integrated into nursing curriculums. Specifically, the models have been adopted in 26 countries and cited in 250 journal articles and books. The book has also been translated into 8 languages, including Japanese, French, Portuguese, Swedish, German, Icelandic, Spanish, and Korean, with 150,000 textbooks having been sold worldwide. To illustrate how to apply family nursing skills in actual clinical practice, Dr. Leahy and Dr. Wright also wrote and produced the How to Family Nursing DVD series, which consisted of 8 educational videos. Each video demonstrated actual family interviews. These DVDs have been distributed and utilized worldwide. To illustrate how to apply family nursing skills in actual clinical practice, Dr. Leahy and Dr. Wright also wrote and produced the How to Family Nursing DVD series, which consisted of 8 educational videos. Each video demonstrated actual family interviews. These DVDs have been distributed and utilized worldwide. In her administrative roles within Alberta Health Services, her in-depth knowledge about caring practices with families experiencing illness was utilized by nurses and a variety of healthcare professionals who sought her knowledge and clinical supervision of how to include families in their clinical practice. From 1985 to 2010, she co-founded and directed the Family Therapy Training Program, which was Western Canada's only accredited training program. In the early 1990s, long before knowledge translation research in nursing was popular, she received research funding to conduct a groundbreaking study where family nursing was translated into the daily clinical practice of nurses on a busy medical surgical unit. Both family and nurse outcomes were evaluated. From 1996 to 2011, Dr. Leahy served as manager of all outpatient mental health programs in the Calgary region of Alberta. The responsibilities in this position were daunting, but Dr. Leahy shone with her incredible ability to manage multiple programs and staff. Dr. Leahy's masterful ability to cross disciplinary boundaries related to family-focused practice while leading the delivery of mental health programs enabled her expertise to have a sustained positive impact for more than 3 decades. Hundreds of families in Alberta, Canada have benefited from her clinical mentorship, supervision, and knowledge about skills practice to families experiencing illness. Over these years, Dr. Leahy has shown an outstanding ability to create, demonstrate, and teach about caring practices with families experiencing illness. The second Excellence in Family Nursing Award is given to Dr. Lorraine Wright. Dr. Wright is a Professor Emeritus of Nursing, University of Calgary, Calgary, Canada. She is also an international speaker, author, blogger, and consultant in family nursing. Her sustained, outstanding, and internationally renowned contributions to advanced family nursing are indisputable. Through her exceptional achievements, she has transformed family nursing by substantially advancing the theory, practice, research, and education in the field. Thanks to her vision, her exceptional leadership, as well as her remarkable ability to transfer theoretical knowledge to clinical practice, Dr. Wright has promoted the advancement of knowledge in family nursing care and thereby has extended the boundaries of nursing practice in Canada and around the world. A distinguished nurse, researcher, and great communicator, Dr. Wright has made her mark in nursing science by leading the development of 4 theoretical models: the Calgary Family Assessment Model, the Calgary Family Intervention Model, the Illness Beliefs Model, and the Trinity Model. Drawing inspiration from schools of thought in nursing, as well as theories from related disciplines, Dr. Wright's work has truly transformed the nursing care of families dealing with health problems. In terms of research, Dr. Wright's activities center around studying the process of therapeutic change of family nursing interventions. This field of interest, still underexplored despite its extreme relevance, has required innovative research approaches to demystify and better understand this black box in the relationship between nurses and families. It is from the results of this research that Dr. Wright and her colleagues, Dr. Wendy Watson and Dr. Janice Bell, developed the Illness Belief Model to guide advanced family systems nursing practice. Their work is published in their book entitled Beliefs in Illness, A Model for Healing. In addition to the development of the Illness Beliefs Model, Dr. Wright's clinical practice and research has created a conceptual framework that allows for a better understanding of the interplay between beliefs, suffering, and spirituality. This model, which she named the Trinity Model, was the subject of her book, Suffering and Spirituality: The Path to Illness Healing. With the aim of facilitating the transfer of knowledge of the practice of nursing to the family, Dr. Wright founded the Family Nursing Unit, FNU, in 1982, within the Faculty of Nursing, University of Calgary, of which she was the director until 2002. It was in this clinic that Dr. Wright developed an educational strategy enabling graduate nursing students to develop their family assessment and intervention skills. These students conducted therapeutic interviews with families who presented with a health problem, and live supervision for every interview was provided by their professors specializing in this family systems approach. Dr. Wright also demonstrated her own clinical scholarship by interviewing families for graduate students to observe her clinical skills. This innovative idea for the education of nurses in family systems nursing captured the interest of over 250 nurse and other health professionals from Canada and foreign countries who visited the FNU to learn and observe the teaching and research of this clinical approach. The FNU served as a model for similar family nursing practice units in other faculties of nursing in Canada and abroad. Finally, within the FNU context, for 21 years, Dr. Wright and her colleague, Dr. Janice Bell, offered a week of intensive educational immersion in their family systems approach. They have welcomed hundreds of nurses, including leaders in the field of family nursing from Australia, Brazil, Canada, Denmark, Finland, Iceland, Japan, Spain, Sweden, Thailand, and the United States to their family nursing externships. Dr. Wright is a leading authority and distinguished figure whose remarkable and indelible contributions has shaped the advancement of knowledge and practice in family nursing around the world. The third Excellence in Family Nursing Award is given to Dr. Sandra Eggenberger, who is the founding director of the Glenn Taylor Nursing Institute for Family and Society and distinguished professor at Minnesota State University, Mankato, USA. Dr. Eggenberger is being recognized for her outstanding and sustained contribution to the development of family nursing practice, research, and education over many years. As the director of the Glenn Taylor Nursing Institute for Family and Society since 2009, Dr. Eggenberger works to advance family and societal health and healing. Numerous advancements at the Institute include the development of a multi-site family nursing training program for practicing nurses and partnering with families and communities through monthly community family forums to create family in community action projects. Dr. Eggenberger has developed, tested, and disseminated nursing education pedagogies and nursing practice models that continue to be important in the further advancement of family nursing practice locally, nationally, and internationally. Dr. Eggenberger has worked to develop services for families through innovative clinical academic partnerships. Dr. Eggenberger was instrumental in launching the Health Commons at Pond, which is a no-cost, school-based clinic for students in need, staffed by students and faculty from the School of Nursing, Minnesota State University, Mankato. This clinic allows nursing students to learn by doing in this real-life, practical situation, and this clinic has been shown to be making a real difference for students and their families. She has also led the development and testing of digital storytelling as a methodology to translate evidence-based family nursing interventions into practice, to teach the methods of capturing nurses' stories electronically. Dr. Eggenberger has played an active role in IFNA since the organization's inception. She currently serves as the secretary of the IFNA Board of Directors, as well as being the chair of the Acute Care Cluster in the IFNA International Research Subcommittee. Through leading multiple family nursing research initiatives and publishing numerous peer-reviewed articles and books, Dr. Eggenberger has played an important role in supporting the scholarship of family nursing research and practice over the years. Her work within acute care is widely recognized as being significant value to the clinical area globally. Dr. Eggenberger has very successfully led a recent global research study spanning 10 countries to describe critical care nurses' engagement with families in these different contexts. The results of this study have important ramifications for the development of family engagement interventions. Dr. Eggenberger is an inspiring leader for family nurse researchers and practitioners, as well as a passionate mentor to students. She clearly articulates and advocates how research can impact policy and clinical care. Dr. Eggenberger has had a significant impact on the practice, research, and education of family nursing nationally and internationally. The second award category is the Innovative Contribution to Family Nursing Award. This award recognizes IFNA members who have provided sustained leadership in innovatively disseminating and implementing family nursing theory, research, and/or practice in their countries and languages. Dr. Joel Anderson is receiving this award. Dr. Joel Anderson's innovative contributions to family nursing and family health relate to his leveraging of digital research methods to explore family health and the unique contributions of family nursing. Through this work, family nurses and family health providers can improve development and implementation of family health intervention research globally. Named one of the top 20 nursing professors on Twitter in 2017, Dr. Anderson's professional social media presence continues to increase the reach and impact of his world-first research in family nursing using digital research methods in the field of caregiving and dementia. Dr. Anderson has led an examination of blogs written by family caregivers of people with dementia to characterize the family caregiving experience, offering new, person-centered insights to drive the development and testing of novel interventions and services. The use of these digital methods offers a window into the caregiving experience unmatched by more traditional research methods, allowing him and his colleagues to examine sensitive topics among caregivers, such as suicidal and homicidal ideation, topics that are incredibly important to the field of family nursing. Findings from his research with colleagues at the University of Exeter on this topic illustrated the prevalence of this issue, lending person-centered information for developing strategies to support the mental health needs of family caregivers. Dr. Anderson has garnered an international reputation for this social media-focused work that is relevant to family nursing, providing guest lectures and research consultations on digital research methods at the University of Exeter in the United Kingdom and the Center for Medicine and Aging at the University of Stavanger in Norway. In addition to his use of social media data, Dr. Anderson uses digital research methods to recruit and collect data among populations considered hard to reach or hidden, specifically sexual and gender minority caregivers of people with dementia. His work has demonstrated that sexual and gender minority adults more frequently use the internet to seek health information than their heterosexual counterparts. Taking advantage of this insight, Dr. Anderson's recent research study funded by the National Institute on Aging used digital methods to collect data via social media-based recruitment targeted towards self-identified sexual and gender minority caregivers of people with dementia. These methods increased accessibility and reduced exclusion of rural caregivers or caregivers with fear of discrimination, thereby broadening the understanding of the sexual and gender minority caregiver experience. Dr. Anderson continues to increase awareness among family nurses and family health providers of strategies for leveraging digital methods to expand family nursing theory, research, and practice. The last award category is Rising Star in Family Nursing Award. This award recognizes an IFNA member who has shown exceptional early career efforts to advance family nursing by contributing to the dissemination and implementation of family nursing as a new scholar. Dr. Waikia Wu-Wen is receiving this award. Dr. Waikia Wu-Wen has been instrumental in promoting family nursing research and mentoring students in China. Dr. Wu-Wen spoke on sleep health and chronic illness management in families, from descriptive studies to interventional trials. She highlighted the importance and sparked significant interest in our students and faculty to learn more about conducting research that engages the entire family rather than only the persons with an illness. Dr. Wu-Wen was invited to visit the 3rd Zhangjiang Hospital of Central South University and consult on research project. Dr. Wu-Wen's scholarship focuses on examining the interplay of culture and health and promoting health among historically oppressed individuals, families, and communities. Dr. Wu-Wen has worked with cross-cultural populations and communities, including Black, Latinx, Asian Americans, and Pacific Islanders, and internationally with nurses in China and Bolivia. She is currently the principal investigator of 2 projects, one locally funded and one NIH funded, developing, testing, and disseminating technology-enabled health solutions to increase access to tailored symptom of self and family management support in vulnerable children and their families. Dr. Wu-Wen leads the Caring for Caregivers Online, COCO project, which has received a series of funding to develop and test English and Spanish version of a cutting-edge technological. Dr. Waikia Wu-Wen has been instrumental in promoting family nursing research and mentoring students in China. Dr. Wu-Wen spoke on sleep health and chronic illness management in families, from descriptive studies to interventional trials. She highlighted the importance and sparked significant interest in our students and faculty to learn more about conducting research that engages the entire family rather than only the persons with an illness. Dr. Wu Wen was invited to visit the 3rd Sainja Hospital of South Central University and conduct on research projects. Dr. Wu Wen's scholarship focuses on examining the interplay of culture and health and promoting health among historically oppressed individuals, families, and communities. Dr. Wu Wen has worked with cross-cultural populations and communities, including Black, Latinx, Asian Americans, and Pacific Islanders, internationally with nurses in China and Bolivia. She is currently the principal investigator of 2 projects, one locally funded and one NIH funded, developing, testing, and disseminating technology-enabled health solutions to increase access to tailored symptom self and family management support in vulnerable children and their families. Dr. Wu Wen leads the Caring for Caregivers Online, COCO project, which has received a series of funding to develop and test English and Spanish versions of a cutting-edge technological solution for family caregivers. As an early family nursing scholar, Dr. Wu Wen has embraced and delivered the notion that family-focused care is essential for the promotion of health of patients and their families, and she has a goal to advance knowledge about what interventions are useful for the parents to adapt their role and become a competent caregiver. She is truly a rising star and an inspiration for all. Thank you for attending the award ceremony and for everyone who nominated applicants for these awards. Please look for these outstanding awardees throughout the conference. Congratulations to all of our awardees.